Hello, this is Dr. Mark Dailey, and today we're going to talk about the GI stool profile. We're going to get a bit more detailed about the test, why we do it, and what kind of information we may get from this test. Before we get started, I want to remind you that proper gastrointestinal function is crucial to adequate nutritional status and can impact all aspects of your body's function. The GI stool profile addresses key components of proper GI health, including measurements of beneficial microbial flora, opportunistic bacteria, yeast, parasitic infection, markers of inflammation, immune function, and digestion and absorption. In my view, the gastrointestinal tract is like the hub of a very important wheel. So it's the center of the wheel, and its spokes reach every area of the body, every body system. To give you an idea, 60 to 80% of your immune system is located in the gut. Roughly 60% of the serotonin in your body is produced in a healthy gut. Remember, serotonin is the happy neurotransmitter. That's why many antidepressants are serotonin uptake inhibitors, which basically means serotonin stays in circulation longer. Roughly 20% of the inactive thyroid hormone, T4, is converted to the active T3 hormone in a healthy gut. The thyroid regulates metabolism and temperature, just to name a few. Healthy gastrointestinal tract is vital for proper digestion and nourishment. That's what powers your body. Proper function of your adrenal and thyroid glands depends on healthy gut function. Now, when we find things like abnormal bacteria or fungus and parasites, we suspect a number of different things. For one is inadequate physical and immune barrier function. When we say immune barriers, we're talking about things like, well, your skin is a barrier. There's a blood-brain barrier. There's a lung barrier, and there is a GI barrier. When we see disruptions in these, we think about food sensitivities and leaky gut syndrome, low intestinal secretory IgA, gluten intolerance or celiac disease, inflammatory bowel disease, decreased colonic short-chain fatty acids. Then the cause could possibly be, we think about, this could be caused in addition by medicines like antibiotics or non-steroidal anti-inflammatories, antacids, proton pump inhibitors, and acid blockers. Can be caused by inadequate digestive and absorptive function, which makes us think about hypochlorhydria, which is not enough stomach acid, pancreatic insufficiency, intestinal inflammation, rapid transit time, which can be caused by diarrhea, nutrient insufficiencies, diets high in red meat, saturated fats, or refined carbohydrates. Also, pathogenic invasions and gut flora imbalances, which gut flora imbalances is also known as dysbiosis. Exposure to pathogens can be caused by water or food contamination, foreign travel, or a depressed immune system, and inadequate predominant flora. So, microorganisms in the GI tract perform literally a host of useful functions. And this is really important for you to understand. It performs functions like fermenting unused energy substances. It communicates with the immune system, preventing growth of harmful species. It regulates the development of the gut itself. It produces vitamins for the host like biotin and vitamin K, and produces hormones to direct the host to store fats. Intestinal microflora, or good bacteria, are also thought to have many beneficial local and systemic roles, such as improving lactose tolerance, supplying short-chain fatty acids, and energy substrate for the host, anti-tumor properties, neutralizing certain toxins, stimulating the intestinal immune system, reducing blood lipid levels and preventing obesity and type 2 diabetes. So it's really important to have the proper percentages of good bacteria. Under normal homeostatic conditions, the intestinal microflora are of central importance in preventing colonization by pathogens termed as colonization resistance. So in simple terms, the good bacteria stop the bad bacteria from proliferating or growing too large in number. Predominant organisms are considered to be beneficial when they are in balance. So balance is the key. One of the things we're looking for is low predominant or low good bacteria. The significance is predominant bacteria should be present at normal levels in a healthy gut. Low levels of this beneficial bacteria, such as Bifidobacter or Lactobacillus or E. coli, have been associated with irritable bowel syndrome, characterized by alternating diarrhea, cramps, and food intolerance. Low levels of good bacteria increase the likelihood of acquiring opportunistic or pathogenic organisms. We're looking for opportunistic bacteria, which are generally self-limiting and not normally considered pathogenic. They're often made worse by low good bacteria, pathogens or parasitic infections, poor diet, antibiotic use, which is rampant. There's also antibiotics in much of the food we eat, and lowered gut immunity. We're looking for pathogenic bacteria like H. pylori. This bacterium causes peptic ulcers and has been associated with increased risk of gastric cancer. H. pylori is a type 1 carcinogen. It's estimated that about 50% of the world's population is infected with H. pylori. Symptoms would include acute gastritis with abdominal pain, nausea, and vomiting, usually 2 weeks of infection. Recurrent abdominal symptoms without ulcers are also very common. Other pathogenic bacteria can cause symptoms that are generally abrupt. Influenza-like symptoms are common, including headaches and malaise. GI symptoms include abdominal pain, nausea and vomiting, diarrhea, and reactive arthritis. We're looking for the presence of yeast and fungal overgrowth. Candida is normally an inhabitant of the GI tract flora and is present in 40 to 65% of the human population with no harmful effects. However, in conditions allowing for overgrowth, Candida is the most common causal agent of opportunistic fungal infections. The esophagus is the most commonly affected site, followed by the stomach, then small and large bowel. Approximately 15% of people develop systemic Candida. Symptoms may be gastric pain, nausea, vomiting, bloating, intestinal permeability, imbalances in gut microflora, opportunistic bacterial infections. Then we also look for parasites. A lot of people think of worms when they think of parasites, but over half of all Americans will be infected with an intestinal parasite at some point in their lives. Yet many of us don't recognize the signs and symptoms of a parasitic infection because they can occur weeks or even years after intestinal infection. And because of a parasitic infection, it often mimics other similar conditions. The most common symptom of a parasitic infection include, and get this, constipation, diarrhea, so you can go either way, gas and bloating, irritable bowel syndrome, joint and muscle aches, anemia, allergies, skin conditions, tumors, nervousness, sleep disorders, grinding of teeth, chronic fatigue, and immune system dysfunction. We're also looking for depressed short-chain fatty acids or N-butyrate. Beneficial short-chain fatty acids come from dietary carbohydrates that have escaped digestion or absorption in the small bowel, or from prebiotics that have undergone fermentation in the colon. They are also produced by fermentation of fiber by anaerobic bacteria in the large bowel. Production of short-chain fatty acids in the intestinal lumen plays an important role in the maintenance of the intestinal barrier. We talked about barriers earlier. Short-chain fatty acids, and specifically N-butyrate, serve as the fuel for the colonocytes. Butyrate has been shown to be protective against colon cancer. So obviously we want it there in the proper proportion. Possible causes of depressed short-chain fatty acids are low anaerobic bacteria, antibiotic treatment, insufficient fiber intake, poor diet, slow transit time, which can also be known as constipation. We look for inflammation, and for those of you who have talked to me or watched or read my material, inflammation is a big deal. When we talk about inflammation, we consider systemic or system-wide inflammation. Lactoferrin is an iron-binding glycoprotein released from neutrophils during the inflammatory process. It's a marker of leukocyte activity, which is the immune system, part of the immune system, and is a primary component of the host's first-line immune defense against infection. Possible causes could be mucosal inflammation, bacteria or yeast overgrowth, parasitic infection, inflammatory bowel disease like Crohn or ulcerative colitis. We're also looking for decreased levels of secretory IgA. Secretory IgA is the mucosal lining of the gastrointestinal tract and the first line of your immune defense in your gut. Possible causes are chronic stress. Now, this chronic stress can be from emotions that come from outside your body, but they can also come from stress within your body, like parasites, like yeast overgrowth, and so many other things. They can come from immunocompromise, dysbiosis, which is the disproportional amount of good to bad bacteria, and immunosuppressing medications. Elevated fecal secretory IgA can be caused by an immune response to eliminate pathogenic organisms in the GI tract. It can be caused by food sensitivities. We're also looking for anti-gliadin antibodies. The cause of this would be gluten sensitivities. Many of you have heard of that here lately. It's a big deal, and many people suffer from gluten sensitivities. We look for depressed elastase 1. Elastase 1 is a digestive enzyme excreted by the pancreas exclusively and has a direct correlation with pancreatic function. The cause could be suppressed pancreatic function, gallstones, or post-gallbladder removal, chronic pancreatitis, diabetes, hypochlorhydria, which is not enough stomach acid, systemic or cystic fibrosis. Depressed pH is something else we look for. It can be caused by bacterial overgrowth, carbohydrate maldigestion, lipid malabsorption, and rapid transit time, which again can be diarrhea. Elevated pH can be caused by decreased bacterial production of these short-chain fatty acids, insufficient flora, dietary fiber or water, inadequate acid-producing organisms like lactobacillus, hypochlorhydria, again, not enough stomach acid. High meat diet can also stimulate ammonia production in the bowel. We look for slow transit time. Elevated pH increases the risk for colon cancer. So I know that there's been a lot of material here, but there are several other things you can glean from this test, but I'm sure you can see that we do get a lot of very, very valuable information from the test. With this information, we design our patient-specific treatment plan designed to improve the health of your gut function. Remember, the gastrointestinal tract is the hub of a very important wheel, and that wheel revolves around your health. Some of you watching this video are about to do the test, or possibly consider doing the test. I hope the information was helpful. If you have any other questions, feel free to call us at our office. Thanks so much. I appreciate your time. God bless, and I wish you the very best of health.